Understanding fatty liver disease, origins, classification, and dangerous consequences. In the realm of medical conditions affecting the liver, one term that has been increasingly cropping up is fatty liver disease. This condition, also known as hepatic steatosis, has garnered attention due to its rising prevalence, especially in the Western world. In this comprehensive article, we will delve deep into the intricacies of fatty liver disease, exploring its origins, classification, and the potentially dangerous consequences it can unleash upon the human body. Learn more about managing fatty liver disease in our comprehensive course. Unraveling the origins of fatty liver disease. The role of lifestyle choices. Fatty liver disease doesn't discriminate, it can affect individuals from all walks of life. However, certain lifestyle choices and habits have been closely linked to its development. We have observed a strong correlation between excessive alcohol consumption and alcoholic fatty liver disease. This form of the condition often results from chronic alcohol abuse, causing the liver to accumulate fat deposits. On the other hand, non-alcoholic fatty liver disease, NAFLD, has emerged as a major concern in recent years. It primarily stems from obesity, insulin resistance, and metabolic syndrome. In this case, fat accumulates in the liver even without excessive alcohol consumption, making it a critical health issue associated with the modern sedentary lifestyle. The genetic factor. While lifestyle choices play a significant role, genetic predisposition also contributes to the development of fatty liver disease. Some individuals may have a genetic makeup that makes them more susceptible to accumulating fat in the liver, even with relatively healthy habits. Classifying fatty liver disease. Alcoholic fatty liver disease, AFLD. Alcoholic fatty liver disease, as the name suggests, is closely tied to excessive alcohol intake. It manifests in 3 stages. Alcoholic fatty liver, AFL. The initial stage characterized by fat accumulation in the liver due to excessive alcohol consumption. Alcoholic hepatitis, AH. Progressing from AFL, AH is a more severe form of liver inflammation caused by alcohol abuse. Alcoholic cirrhosis, AC. The advanced stage where the liver becomes severely scarred, leading to irreversible damage. Non-alcoholic fatty liver disease, NAFLD. NAFLD is a diverse condition that encompasses a range of liver abnormalities. It can be further classified into non-alcoholic fatty liver, NAFL. The benign accumulation of fat in the liver, often asymptomatic but still concerning. Non-alcoholic steatohepatitis, NASH. A more severe form of NAFLD marked by liver inflammation and potential liver cell damage. The dangerous consequences of fatty liver disease. Understanding the potential consequences of fatty liver disease is crucial for grasping the gravity of this condition. Cirrhosis, a looming threat. Both AFLD and NASH can progress to cirrhosis, a condition where the liver tissue becomes scarred and loses its ability to function effectively. Cirrhosis is a serious and irreversible stage of liver disease, often necessitating a liver transplant for survival. Increased risk of cardiovascular disease. Fatty liver disease doesn't restrict its impact to the liver alone. Research has shown a strong association between NAFLD and an increased risk of cardiovascular disease. This underscores the systemic nature of the condition and the need for comprehensive healthcare management. Learn more about managing fatty liver disease in our comprehensive course. Liver cancer, a dire complication. Another perilous consequence of advanced fatty liver disease is the heightened risk of developing liver cancer, medically termed hepatocellular carcinoma. Individuals with cirrhosis, whether due to AFLD or NASH, face a substantially elevated risk of this life-threatening cancer. Early warning signs and risk assessment. Recognizing the red flags. To truly appreciate the implications of fatty liver disease, we can turn to real-life examples. Consider the case of John, a middle-aged man with a history of heavy alcohol consumption. Over the years, he developed AFLD, which progressed to alcoholic cirrhosis. His quality of life deteriorated, and he became reliant on medical interventions to manage his condition. Then there's Sarah, a young woman who appeared healthy on the surface but struggled with obesity and insulin resistance. Unbeknownst to her, NAFLD was silently taking root in her liver. Eventually, she was diagnosed with NASH, which, if left unchecked, could lead to cirrhosis or worse. Case studies. John's struggle with AFLD, alcoholic fatty liver disease. John's story is a poignant reminder of the devastating effects of excessive alcohol consumption on the liver. Despite being aware of the risks, John found himself battling cirrhosis, a late-stage liver disease often caused by chronic alcohol abuse. His journey illustrates the urgent need for alcohol addiction treatment and the potential consequences of ignoring the dangers of excessive drinking. Sarah's silent battle with NASH, non-alcoholic steatohepatitis. Sarah's journey sheds light on the importance of early detection and awareness of NASH, a condition often referred to as a silent epidemic. Despite appearing outwardly healthy, Sarah was silently developing NASH, a progressive liver disease linked to factors such as obesity and metabolic syndrome. Her story emphasizes the significance of regular health checkups and screenings to catch liver diseases in their early stages. Success story. David's journey to sobriety and recovery. David's journey towards sobriety not only saved him from AFLD, alcoholic fatty liver disease, but also inspired others to seek help for alcohol-related liver conditions. His story highlights the transformative power of addiction recovery and its potential to prevent further liver damage. Frequently asked questions, FAQ. What are the early warning signs of fatty liver disease? Early signs may include fatigue, abdominal discomfort, and mild jaundice. However, it often progresses silently without noticeable symptoms. Can fatty liver disease be prevented? Yes, adopting a healthy lifestyle, maintaining a balanced diet, limiting alcohol consumption, and managing underlying conditions like obesity can reduce the risk. How is fatty liver disease diagnosed? Diagnosis typically involves blood tests, imaging studies like ultrasound or MRI, and sometimes a liver biopsy for confirmation. What is the treatment for fatty liver disease? Treatment focuses on lifestyle changes, such as weight loss and alcohol cessation. Medications may also be prescribed in certain cases. Is fatty liver disease reversible? Yes, in its early stages, fatty liver disease is often reversible through lifestyle changes and appropriate medical management. Can fatty liver disease lead to liver cancer? Yes, advanced stages of fatty liver disease, including cirrhosis, increase the risk of liver cancer, hepatocellular carcinoma. Are there any complications associated with fatty liver disease? Yes, complications include cirrhosis, liver failure, cardiovascular disease, and an increased risk of diabetes. Is genetic testing necessary for fatty liver disease risk assessment? Genetic testing is not routine but may be considered in cases of strong family history or suspected genetic predisposition. How often should individuals at risk of fatty liver disease be screened? Screening frequency depends on individual risk factors, but periodic monitoring is essential for early detection. Can fatty liver disease be completely cured? Complete cure is achievable in some cases, especially when detected early and managed effectively. However, advanced stages may require ongoing care and monitoring. Conclusion. In conclusion, fatty liver disease, with its diverse origins, classifications, and dangerous consequences, demands our attention. It is a condition that can affect anyone, from those who indulge in excessive alcohol consumption to individuals with underlying metabolic issues. By understanding its intricacies, real-life examples, and potential outcomes, we can take proactive steps toward prevention, early intervention, and, in some cases, successful recovery. Remember, knowledge is a powerful tool in the fight against fatty liver disease, and staying informed is the first step toward a healthier future. We encourage you to explore our comprehensive course on managing fatty liver disease for a more in-depth understanding and practical guidance on how to protect your liver and overall well-being. Education is key, and taking the right steps today can lead to a healthier tomorrow. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.